Cystic fibrosis presented by Jacqueline Mitchell, student physical therapist assistant. So what exactly is cystic fibrosis? Cystic fibrosis is an autosomal recessive disorder. It's an inherited life-threatening disorder that damages the lungs and the digestive system. The disease affects all the exocrine glands of the lung and the pancreas. So this cell produces like your mucus, your sweat, and your digestive juices. So cystic fibrosis causes these liquids to become thick and sticky. So in return, they plug up like your tubes, your ducts, and your passageways in the body. This also prevents the pancreas from releasing digestive enzymes that's needed to break down your food. So this results in weight loss and malnutrition in cystic fibrosis patients. So a little history about cystic fibrosis. It was first diagnosed as cystic fibrosis of the pancreas in 1938 by Dr. Dorothy Anderson. The disease was discovered based on autopsy results of kids who had died of malnutrition. The disease was formerly known as mucoviscosis, which referenced the attention to the thickened mucus in the body. So there's a CTFR gene that's identified, and this is leading to an increase in survival when the genetic test is done. So exactly how do you get cystic fibrosis? So as I said before, it's a hereditary disease, which means that it's inherited from your parents who are carriers or who have the disorder themselves. So the CTFR gene, which is the cystic fibrosis transmembrane conductase regulator. So here on the right, you can see that, so if two parents are both carriers, there's a 25% chance that one of their kids will have cystic fibrosis. If one is a carrier and one actually has the disorder, then there's a 50% chance that the child will have cystic fibrosis. So what symptoms can you expect to see if you have cystic fibrosis? So you will experience abdominal pain, shortness of breath, wheezing. You may experience delayed puberty, fatigue, bronchitis. Some patients have a chronic cough with blood or phlegm, diarrhea, fat in your stool, heartburn, severe constipation, pulmonary hypertension, lung infection, inability to gain weight, and salty tasting skin. So when should you expect to be diagnosed with cystic fibrosis? So children in the United States are screened at birth and through the newborn stage. Most cases of cystic fibrosis are diagnosed by the age of 2. However, since universal screening just began relatively recently, some adults are being diagnosed after experiencing symptoms and being tested, meaning my mother and father may not have had the screening when they were born. So now if they begin to have these symptoms, they will get tested. Okay, so how is cystic fibrosis diagnosed? Okay, so there are several tests that can be ran to determine if you have cystic fibrosis. There's a genetic test that's going to be looking for a mutated CFTR gene, as we discussed earlier. There are also prenatal diagnostic tests, and these can be done on an unborn baby by taking a sample of the amniotic fluid or tissue from the placenta. There's immunoreactive trypsinogen. It's going to be a blood test that checks the level of the chemicals made by the pancreas. And then there's a sweat test for high sweat chloride. This is just going to test to see if someone has high levels of chloride in their sweat. So who does cystic fibrosis affect the most? So cystic fibrosis commonly affects the Caucasian population, The disease is going to occur 1 in every 2,500 to 3,500 of Caucasian newborns. In the African American population, there's only 1 in 17,000 that's diagnosed with cystic fibrosis. And in the Asian American population, there's only 1 in 31,000 of the American Asian population that's diagnosed with cystic fibrosis. And you can see here by the chart that I provided that it's extremely high for Caucasians. So what's the prognosis for cystic fibrosis? As we said before, it's an uncurable disease. So right now, the lifespan for people who have cystic fibrosis is about 44 years. And the survival rate is higher for males than it is females. Okay, so as you can see here, I included a chart for over the years back in like 1986 to 1990. Their lifespan was only about 28 to 30 years old. So what kind of treatment can you receive? As we said before, there's currently no cure. However, there are treatments that are used to ease symptoms and reduce complications. These are antibiotics to prevent and treat lung infections, anti-inflammatory for inflammation, cough medicines to break up the mucus, and then you also have nebulizer care treatments that you can do at home for your respiratory treatments. So the newest research or treatment that's available came out in 2019, and it's going to be an FDA approved triple combination therapy. So it takes 3 drugs that's known for treating cystic fibrosis and puts them together. So it's elacicaftor, tezacaftor, ivacaftor. So they call the drug Trikafta. Okay, and this is for patients who is 12 and older. The approval of these drugs means that approximately 90% of people with cystic fibrosis could eventually have a highly effective treatment. Also, medical and surgical management, a lung transplant can be performed to replace the affected lungs. Now, even though the patient may get new lungs that do not contain cystic fibrosis is still going to be in other organs in their body. So they will have to continue to receive treatment to manage the cystic fibrosis. So what can we do in physical therapy to help our patients who have cystic fibrosis? So in physical therapy, we have something called chest physical therapy, CPT, that is used as a treatment for cystic fibrosis patients. So basically, we use a technique called airway clearance technique, and this drains the lungs. It includes percussion, vibration, deep breathing, huffing, and coughing. So we'll position the patient against gravity so the mucus will be able to drain from the lungs. The physical therapist will clap using a cupped hand, or when they do vibration, they'll use flat hands, and this will loosen the mucus in the person's chest and allow it to move to larger airways where it can be coughed or huffed from the body. So on YouTube, I will include a link at the bottom where you can watch a video of this being done in a physical therapy setting. All right, so what are the contraindications and precautions? We're never going to clap or percussion over the spine, breastbone, stomach, or lower ribs or back. You're always going to remove tight clothing and jewelry around the neck and chest. Never do chest physical therapy on bare skin. And the PT or PTA should remove rings and other bulky jewelry such as watches and bracelets. So in conclusion, cystic fibrosis is a disease that a person cannot get rid of. It affects the exocrine glands and causes blockages of the airways due to the thick mucus and sweat. So let's remember to remind our patients that although they may have cystic fibrosis does not have them. Remember to just breathe.